Welcome back, everyone. Today, we're going to be doing a deep dive on something you might not have heard of before.
Okay.
It's called silent ischemia, and it's a heart condition that a lot of people don't really know about,
Right.
and it can be really dangerous, especially for seniors.
Absolutely.
So,
Yeah, so ischemia basically just means reduced blood flow
Yeah.
to a certain part of the body. And in this case, we're talking about the heart.
gotcha.
And the silent part is what makes it so tricky because unlike a typical heart problem,
Right.
You don't experience the usual warning signs like chest pain.
So it's kind of like a stealthy heart issue.
Yeah, exactly. It's very sneaky.
It's especially for older adults who might have other conditions going on already.
Exactly. And they might not attribute any symptoms they're having to their heart.
Right.
So it's really important to be aware of.
I'm curious, how common is this and who's really at risk for this?
Well, the numbers are actually pretty startling. The American Heart Association estimates that 3 to 4 million Americans experience silent ischemia every year.
Wow, that's a lot.
It is, yeah. It's way more common than people think.
So it's almost like a hidden epidemic, particularly among seniors, it sounds like.
Yeah, you could say that.
You mentioned other risk factors besides age. Are there any that are especially important for older adults or their caregivers to be aware of?
Absolutely.
Okay.
A history of heart attacks is a major red flag.
Right.
If you or a loved one has had a heart attack in the past,
Okay.
the risk of silent ischemia goes up significantly.
Gotcha.
Other conditions that are common in seniors, like diabetes and high blood pressure,
Yeah.
also play a role.
Okay, that makes sense.
And then, of course, there are lifestyle factors like smoking,
Mhm.
which can really damage those blood vessels over time.
Yeah, so many things that are more common as we age could be contributing to this.
Exactly. It's all connected.
So if you're caring for an aging parent or loved one, this is definitely something to keep in mind.
For sure.
But how do you even know if someone has it? Especially if there's no pain. That seems like a real challenge.
It is. You're absolutely right. That's the biggest hurdle.
Right.
The lack of pain makes diagnosis really tricky.
Okay.
But, researchers have found that individuals who do experience chest pain,
Yeah.
even if it seems normal,
Uh-huh.
are very likely to also have silent ischemia episodes.
So even typical chest pain in seniors should be taken seriously.
Exactly. It's always better to be safe than sorry.
Right. It could be a sign of something more serious going on.
Absolutely. And that's why monitoring and diagnosis are so crucial.
Okay, so how do doctors go about unmasking this problem?
Well, there are a couple of key tests that they use.
Okay.
One common one is a stress test.
Okay, I've heard of that.
Have you had one?
No, I haven't actually, but I know people who have.
Okay, yeah. So basically what it involves is monitoring your heart activity during exercise,
Mhm.
usually on a treadmill,
Okay.
to see how well blood is flowing through the coronary arteries.
So it's like putting the heart through a workout to see how it performs under pressure.
Exactly.
Interesting. What other tools do they have?
Another important one's the Holter monitor.
Okay.
It's a portable device that records your heart rhythm continuously for 24 hours or more.
Wow.
It's pretty cool. It allows doctors to detect any irregularities that might suggest silent ischemia.
So it's like a little detective on the case.
Yeah, exactly. Gathering clues about your heart's activity throughout the day and night.
It seems like technology is really playing a key role in diagnosing this.
It really is. It's amazing what we can do now.
What happens once silent ischemia is actually diagnosed?
Oh, okay.
What are the treatment options, especially for older adults?
Well, the good news is that treating silent ischemia often involves similar approaches to managing other forms of cardiovascular disease.
Okay, so there are things that can be done.
Yes, absolutely.
That's good to hear. We can break it down into two main categories:
Okay,
lifestyle changes and medical interventions.
perfect. Yep, that's a good way to think about it.
So let's start with those lifestyle changes. What specific recommendations would you give to seniors or their caregivers looking to address silent ischemia through lifestyle?
Well, first and foremost, if smoking is a factor, quitting is absolutely essential.
Right.
It's never too late to reap the benefits of kicking that habit, especially when it comes to heart health.
Makes sense.
Managing existing conditions is also really crucial.
Okay.
Keeping blood pressure, cholesterol, and blood sugar levels in a healthy range is vital.
So it's about taking those existing conditions seriously and working with doctors to manage them.
Yes, exactly.
What about diet and exercise? Are there specific recommendations for older adults?
Absolutely. When it comes to diet, think heart-healthy choices. We're talking about a balanced approach that prioritizes fruits and vegetables, lean proteins and whole grains,
Okay.
and minimizing processed foods, saturated fats, and excessive sugar.
So it's about making smarter choices to fuel the body and support heart health.
Exact.
Are there any types of exercise that are particularly beneficial for older adults dealing with silent ischemia?
That's a great question. It's important to consult with a doctor to create an exercise plan that's tailored to an individual's health status.
Of course.
But generally, low-impact activities like walking, swimming, or gentle yoga can be excellent choices.
Okay.
Even short bursts of activity throughout the day can make a difference. It's not about doing marathons or anything,
Right.
just finding a routine that works for you and sticking with it.
Consistency.
Yes, exactly. Now, while lifestyle changes are super important, sometimes we need a little extra help.
Okay.
That's where medications and surgical options come in.
Let's dive into that. What kind of medications are typically used for silent ischemia, especially in seniors?
Well, doctors often prescribe a combination of medications
Like-
really tailored to the individual's needs.
Makes sense.
Blood thinners, for instance, can help prevent clots,
Right.
which are a major concern when you have reduced blood flow.
Okay.
Oxygen therapy might be used in some cases to boost blood oxygen levels,
Okay.
especially if someone is experiencing shortness of breath.
So it's about addressing the underlying blood flow issue and then also any symptoms that might pop up.
Exactly, a two-pronged approach.
Are there other medications that are commonly used?
Yes, medications to manage heart rate and blood pressure are often prescribed.
Okay.
Things like beta blockers, which can slow the heart rate and reduce blood pressure to lessen the strain on the heart.
Okay.
And there are also medications that help open up the blood vessels
Oh, interesting.
to improve blood flow to the heart muscle.
So there's like a whole toolkit of medications to support heart health.
There really is. It's amazing how far we've come.
But what about those surgical options you mentioned? When might those be considered?
Surgical procedures are usually reserved for cases where medication alone isn't enough,
Okay.
or if the blockages in the coronary arteries are really severe.
Gotcha.
One common procedure is angioplasty,
Okay.
where a tiny balloon is inserted into the blocked artery
Oh, wow.
to widen it and improve blood flow.
It's like a little plumbing job for the heart. Are there other surgical options?
Yes, in more complex cases, coronary artery bypass surgery might be recommended.
Okay.
This involves creating a detour around the blocked portion of the artery,
Right.
using a healthy blood vessel from somewhere else in the body.
Interesting.
It's a more invasive procedure, but it can be very effective.
It sounds like a lot of different treatments are available, from lifestyle changes to medication and even these surgical interventions.
Right.
It must be reassuring for people to know that there are options.
It is, but I imagine it can also be a little overwhelming.
Right. Especially for seniors and their families.
Absolutely.
What advice would you give to someone who's just been diagnosed with silent ischemia? Where should they even start?
That's a great question. First and foremost, don't panic.
Right.
Easier said than done, I know.
Yeah.
But knowledge is power.
Okay.
Understanding the condition and its potential implications is the first step.
So education is key.
It really is.
Yeah.
Then work closely with your doctor or a cardiologist to develop a personalized treatment plan.
Okay, so communication is really important here.
It's crucial. Don't be afraid to ask questions and advocate for yourself.
Be your own best advocate.
Exactly. And remember, lifestyle modifications are often the cornerstone of managing silent ischemia.
Okay.
So focus on those healthy habits we talked about earlier.
Right.
Quitting smoking, eating a heart-healthy diet, and getting regular exercise.
So it's about empowering yourself to take control of your health.
Precisely. And don't underestimate the emotional aspect of this.
Okay.
Living with silent ischemia or caring for someone with the condition can be stressful.
That makes sense.
So don't hesitate to seek support from family, friends, or support groups.
It's okay to not be okay.
Exactly. Talking about your experiences and concerns can be incredibly helpful.
That's an important reminder. It's not just about the physical health, but also the emotional well-being.
Absolutely. They're intertwined.
Now, for caregivers out there,
Yeah.
what advice would you give them? Specifically, what are some things they could do to support their loved ones with silent ischemia?
Caregivers play such a vital role.
I imagine so.
First and foremost, educate yourself about the condition.
Okay.
The more you understand about silent ischemia,
Mm-hmm.
the better equipped you'll be to provide informed support.
Right.
Encourage your loved one to follow their doctor's recommendations.
So be an advocate and a cheerleader.
Exactly. What else can caregivers do to help
Yep.
be patient?
Okay.
Lifestyle changes can be challenging,
Right.
and it takes time to adjust.
For sure.
Offer practical support,
Like what kind of things?
like preparing healthy meals or accompanying them on walks.
Okay.
And most importantly, be understanding.
Right.
Remember, living with a heart condition, especially one that's silent, can be really emotionally taxing.
Compassion goes a long way.
It really does.
It sounds like open communication and a compassionate approach are so important
They're essential.
for caregivers navigating this journey with their loved one.
It's about teamwork working together. Seniors, their caregivers, and healthcare providers can really effectively manage silent ischemia and promote long-term heart health.
Wow. It's been a really insightful conversation about silent ischemia, especially thinking about seniors and their caregivers.
Yeah, it's something a lot of people don't really think about.
We've learned a lot
Right.
from understanding what it is and who's at risk to how doctors are figuring out how to diagnose it and all the different ways to treat it.
Yeah.
What's the one big takeaway message for our listeners today?
I think it's don't let the silence fool you. Just because there's no chest pain doesn't mean there's no problem.
Yeah, silent ischemia is a real threat, especially for older adults.
Exactly.
It's important to be proactive.
Absolutely.
So, what are some concrete steps our listeners can take to protect their heart health or help a loved one who might be at risk?
Start by talking to your doctor if you're concerned about silent ischemia, whether for yourself or someone you care for.
Okay, so have that conversation.
Yeah. Be open and honest about your family history, any health conditions you have, and your lifestyle.
Okay.
Ask about getting screened if you have any of those risk factors we talked about.
It's about taking that first step and being an active participant in your own healthcare.
Exactly. You have a voice. Use it.
Right. And don't forget those lifestyle changes,
Oh, yeah. Those are huge.
like quitting smoking if you smoke, eating a heart-healthy diet,
Uh-huh.
and moving your body regularly.
Yep. All of that can really make a difference.
It's about making healthy choices every day to support your heart.
It really is. And remember, you're not alone.
Right.
There are so many resources out there to help.
Okay.
You can reach out to your doctor, a cardiologist, or even heart health organizations.
There's a whole network of support waiting to help.
Yeah, there are amazing people who are dedicated to helping you stay healthy.
Well, listeners, that brings our deep dive on silent ischemia to an end.
Yeah, thanks for listening.
Hopefully you've learned a lot and feel more confident about taking charge of your heart health
I hope so.
or helping a loved one through this.
Knowledge is the key.
It really is, and it can empower us all to make healthier choices.
Absolutely.
Thanks for joining us today.
Thanks for having me.
We'll see you next time for another deep dive on an important health topic.